Good morning. It's my pleasure to be here and share with you a little bit about a great resource that we have available here at the Medical Center, which I personally think is a little gem or jewel, if you will, that isn't very well known, so it's great to be able to share it with you. As Jeff mentioned, my name is Sharon. I am the program director for our Patient and Family Centered Care Department here at the Medical Center. And one of the roles that I have actually, or the privilege to do, is to work with our patient family experience advisors. So this program actually entails about 150 to 200 of our current or previous patients or family members who have decided to volunteer for us at the Medical Center to really share a little bit with us about their experiences. And usually when I talk with staff, I highlight it's a patient or family member who's had an experience at Ohio State who are serving to advise us as staff or as researchers about that patient experience. Our advisors are all credentialed as volunteers, so they kind of go through that background check, fingerprinting, HIPAA, security, all of the same things that we do as employees, which I think gives us an additional level of security, if you will, when we work with them. They have been patients or family members that have had services at any of our OSU facilities. And they really serve to share their feedback with us on various topics. So normally that happens with advisory councils. We have several advisory councils here at the Medical Center. I often invite researchers to come if they're working on specific projects, that they can come and share a little bit or get some feedback from our patients and families. A lot of times that's involved in the informed consent maybe. Is it clear? Does it make sense to you as a patient? Is there something that we can do to say things a little better so that you understand? Other times that's involving a survey maybe that they want to send out to patients to get some feedback. And our advisory councils can actually help with that literacy part. We do provide patient panels for different areas of the Medical Center as well. And so, for example, I've worked with the College of Medicine to provide a patient panel looking at the cancer experience of being a cancer survivor at different ages. So if you think about a cancer patient who's in their 20s, they obviously have very different concerns that they're working on or thinking about versus somebody who may be in their 60s. And so we can provide patient panels for that as well. We also have done focus groups for researchers in the past who may be looking to explore a little more about different interventions and how that appears to patients and families, and if it's something that they have an interest in. And also online and email surveys, as I've already mentioned, and public speaking. So you've already heard Nancy speak as well. And some of those patients that we have on our advisory councils and our programs are available to speak about their specific patient experiences. As you probably know, when you hear it from the voice of the patient or the family member, they're very passionate and very experienced and sometimes know a lot more about the topics than we may as staff or as researchers. Our program, I think, for researchers specifically can provide some additional resources to you. We do have access to over 200 of our patient family experience advisors who have a variety of diagnoses and experiences. We also have access to about 450 online patients and family members. We have something here called an Insight panel, and that panel is just open to the OSU community in general, where we do provide surveys and questionnaires to our patients and family members. I often recruit for focus groups from this panel. Again, variety of diagnoses. So it is a nice opportunity as well. If you have an interest in either of these, our patient advisors at osumc.edu email address is the best way to contact us. And I have served for the past couple of years as a reviewer for PCORI. So if you or someone you know are working on a PCORI grant, there is a huge patient engagement portion of the PCORI grants, and I'm very familiar with the PCORI engagement requirements as a result. One other thing I would like to highlight today, the CCTS. As Jeff already mentioned, Amanda Kennedy is in the back of the room, and I have her contact information for you on my next slide. One thing that we have struggled with a little bit with our advisor program in general is that recruitment of rare disease participants. For obvious reasons, you know, we only have one or two in the Columbus area. Sometimes they're connected with their individual groups instead of with us directly. So I think Amanda is a great resource for that, and it's really important important to contact Amanda and work with her if you're looking for participants for rare disease research or any type of research. Amanda has those community connections where she can establish those to really reach out and help you find patients and family members that can participate. And the other important part of that, I think, is you may be working on research right now around a specific topic and reach out to Amanda and she helps make that connection, but there may be another researcher in 5 or 10 years even that needs to be able to make that connection as well for that specific population. So Amanda is really great in that essence because she can kind of start that running list of different community organizations based on diagnoses. I've included just my contact information here. If you have any questions, I'm glad to assist you, and I work really closely with Amanda. If there's something I can assist you with, I'm glad to help connect you with Amanda as well. Thank you.